Question says young female presents with well-defined, deeply erythematous plaques which are symmetrical with silvery white micaceous scales. Grattage test and Auspitz sign, both of them are positive. There is evidence of Koebnerisation or Koebnerisation. You can spell it anyway. What is the most likely diagnosis of the scenario? By the clues which are mentioned here, that is there are plaques and there is scaling. So this kind of lesions, whenever they are present, you simply categorize them under papulosquamous disorder. Papulosquamous disorders. And among the given options, option C, option B, both of them can be kept under papulosquamous disorder because they can have these plaques and also there will be scaling in these diseases. And basal cell carcinoma, it is not going to have any papulosquamous lesions, and bustular psoriasis basically will have pustular lesions rather than papules and plaques. Okay, so we can rule this out, and you can very clearly see a beautiful mnemonic for all the conditions which can have papulosquamous disorders in the form of 10 slips. So you can see this is 10 slips. So T stands for tinea. Yes, tinea fungal infection can also be categorized under papulosquamous disorders. E stands for eczema. Yes, the ACD, ICD, they can also be categorized under papulosquamous disorders. N stands for neoplasias. So TEN, N stands for neoplasias. What are those neoplasias? You can remember that with this mnemonic SBM. So State Bank of Mysore is the full form of SBM usually, but here it is squamous cell carcinoma, Bowen's disease and mycosis fungoides. Basically Bowen's disease, it is a carcinoma in situ which is squamous cell carcinoma, and you must remember that basal cell carcinoma is not going to have any papulosquamous lesions. This is very important. And S stands for secondary syphilis, L stands for Lichen planus, and P of course stands for psoriasis, parapsoriasis, Pityriasis urbipilaris, Pityriasis rosea, and S stands for seborrheic dermatitis. So these are all the conditions in which papulosquamous lesions can be seen. And if you look at other clues, yes, Auspitz and Grattage test, I have explained what is this, how is it performed, very detailed way in this video. I will leave the link for that in the iCard, and also I will keep the link in the description as well. And Koebnerisation also I have explained very clearly in a detailed fashion in one other video. I will leave the link for that in the iCard and also in the description. You can check that out, and also I will leave that in the comments also. So out of all the given options, B and C we have selected because they are papulosquamous, and among these two also, please remember the Auspitz sign. Auspitz sign is going to be seen only in the case of option C, chronic plaque psoriasis. So that is the answer here. Yes, in Lichen planus we can see Koebnerisation. Koebnerisation is positive here as well as in psoriasis, but Auspitz sign is negative in Lichen planus, whereas Auspitz sign is positive in the case of psoriasis. So our answer here is going to be option C, and you